Well, hello. I'm pretty excited about this particular opportunity I have to talk with Kishan Shah, who is a former student, a former mentee, and now a friend. And so thank you so much for Kishan being here with us today. But let's start with tell everybody about your school experience. I mean, when did we meet each other and what context was it that we were working together?
Yeah, absolutely. Well, first of all, thank you for having me, Shannon. It's great to be able to give back to students and always a pleasure connecting with you again. Just thinking back to when I first started grad school, really UCF as a whole, when I was applying to grad schools and looking at different programs, one thing that was really important to me was finding a program that was very intentional about supporting students to get hands-on experience. And UCF was one of those programs that helped set up internships, and it was part of the curriculum outside of, the educational classroom component. And so that was really one of the things I was looking for. And just the more I got to know about the program, the alumni that have come out of the program, it just all made sense, and it lined up fairly well. And looking back, I'm super grateful for that decision. And I think I actually had you as a professor, probably one of the first classes I took down there. And just getting to hear from people in the industry, just reaffirmed that decision more and more in all the classes that I had. And so that's really ultimately what landed me there. And just throughout the program as a whole, it was great. The classes taught you something different, all had some of that practical knowledge of how does this actually translate to the industry, which I really appreciated. And even more so now looking back, seeing it in the day to day and understanding how it all fits together, I think is super important. And I think at UCF too, they're great at all the things outside of the classroom that they have to offer, very closely tied with the ACHE Student Associates down in Central Florida's chapter. They have the mentor pods, they have so many different offerings that allows people to get some exposure and experience and different ways to connect outside of the classroom as well.
Yeah, and when you were doing as a student, much like the other recent grads I've talked to, you already mentioned, but you did a lot more than just go to class, right? I mean,
Yeah.
so you were engaged at multiple different levels. And any of the specific programs at ACHE that you felt like were particularly valuable?
Yeah, absolutely. So to your point, I was involved in a good amount of things throughout my time at UCF. And for me, it was being intentional about what I was getting involved in and getting the right experiences to set me up and align towards my goals, which I thought was super important and something I hadn't done in the past leading up to grad school. So wanted to make sure I was thoughtful about that. But through ACHE and the Central Florida chapter, there are a few different things. So one, a great opportunity to work on different committees and really get to work with the executives in the industry that are living and breathing the things that we were learning about. So just the opportunity to build those connections and learn from them and just gain comfort in having those conversations with executives, I think was super valuable. And then also through the chapter, I was able to sign up for their mentor mentee program and actually was able to get paired with a mentor who, um, as you know, is yourself, and was a great opportunity for me to learn and just have some of that ongoing support throughout the program as well and throughout my time there, and really helped me achieve a lot of the things that I was able to after that.
Yeah, we talked, and we do through the mentor pods and other activities. We tell students that engagement is really important for whatever it is you decide to do as you approach graduation. So, as you were getting close to graduation, what did you decide to do?
Yeah, it's a great question. I know I was kind of up in the air about what I wanted to do as I was going throughout the program. Came across administrative fellowships and learned more about those early on in the program, but still wasn't quite sure if that was the path I wanted to go down or if I wanted to start looking for careers. And just the more I got to learn about the programs, the more got to connect with current fellows, it really just came to realize like this was a program. That was something I wanted to pursue. It had a little bit of everything to offer in terms of having a comprehensive learning environment, a little bit of a safe space to learn and transition into the workforce. And ultimately what led me to deciding to apply for administrative fellowships. And part of that process really for me was taking time to think about what I was looking to get out of the fellowship and really how that aligned with my long-term goals. And as someone who didn't come into the UCF program with a ton of healthcare administration experience, I knew I wanted something that would help be a stepping stone versus just trying to dive deep into the industry.
Yeah, and as you were looking at the whole how competitive fellowships were, uh, we always felt like that one of the differentiators would be not just your school grades, but other things. And do you think that all of your other external activities and engagement probably help make a difference in that application process?
Yeah, absolutely. I think a few different ways. One that I alluded to earlier, just having that comfort connecting and speaking with executives and high level leaders definitely helped throughout the interview process and just throughout the whole process as a whole. It didn't feel as intimidating going through it. So that more from a soft skill perspective was super valuable. And then I think just being involved in different ways and having the opportunity to lead different initiatives that we had at UCF and just connecting with students as well gives you something you can speak to. I think when current students reach out about fellowships and interest in them, something question that always comes up is what are you looking for in an applicant that's pursuing a fellowship? And, the one thing the advice I always give is that everyone's coming in and applying with the same background. They're coming in with a master's degree, similar experiences. They've done an internship, they may have worked in the industry, but what are those things that help set you apart outside of that, whether that's getting involved in ACHE in your local chapter, whether that's getting involved in case clubs or just other organizations. I think it gives you something to speak to outside of the traditional applicant. So I know for me it was extremely valuable. I think it helped give me a diversity of experiences to speak to.
So I'll go ahead and spoil it for everyone who's watching your video. But you actually did get a fellowship and uh, ended up somewhere up north in one of my former hometown areas. So tell us what you're currently doing and what that's like.
Yeah, definitely. So I ended up landing an administrative fellowship at the Duke Health Integrated Practice, which um, is Duke Health's large physician practice network of subspecialty care. And we encompass about probably close to 160 to 170 ambulatory outpatient clinics. So one thing I didn't know coming into the fellowship is that it was a lot more than just ambulatory operations. It also was the whole physician practice management side of it, which was something completely new to me, but something I've really come to enjoy throughout the fellowship. And so joined Duke for about a year and a half in the fellowship. It's a 2-year program and actually recently transitioned to a new role where I'm a strategic services associate with our leadership team. So I support our practice president and chief operating officer on a variety of different projects, ranging from, like I said, ambulatory operations, physician practice management, which encompasses things like physician compensation, contracting, a whole range of things that I didn't know exist. And then most recently now helping support with a lot of our new growth and partnership initiatives that we have going on at the practice and across the system.
So what year did you graduate?
So I was August 2022.
So
MHA.
August 22 to today, which is basically 2025, June, less than 3 years, and you're like the chief of staff to this very senior executive team in a very, very large and robust physician practice in a tremendously successful healthcare system. How does that happen? I mean,
Yeah, I think it all ties back to the advice you always gave me, right? thinking back to what is your why at the end of the day, being thoughtful about that early on, taking time to actually reflect on what that is and why you do the things you're doing, was very true throughout the fellowship application and continues to be true. I think if you can sit down and know your purpose and what you're working towards, having those internal values, and that mission for yourself, it really helps guide the path. And for me, it's just knowing and being intentional about the things that I do. And if I sign up for something, making sure I can give it my all versus trying to put my hands in a lot of different pockets.
Boy, this is great. I was going to ask you for advice for our students, but I think you just did that very well. Keyshawn, it's so great to see you and to appreciate the opportunity to stay in touch as your career develops. But thank you so much for what you have done and continue to do to support our academic programs here at UCF and the School of Global Health Management and Informatics.
Absolutely. Thank you, Shannon, for this opportunity.
All right. Take care, my friend.
Thank you.